All right, everybody, we're back again. Movement is my medicine. This week, we're going to talk about kind of a continuation of an episode we did before. A couple weeks ago, we did an episode where we talked about the hip hinge and how important it is to bend at our hips rather than bending at our waist when it comes to lifting things from the floor. So today, we're actually going to continue on from that hinge into a deadlift position, right? So the deadlift is a really simple way of explaining lifting anything from the floor, okay? Whether it's a laundry basket, or a box of books, or a bag of groceries, or this kettlebell that's on the floor. So really simply, what we want to do is focus on hinging from the hips and using our legs to move rather than hinging at the waist and pulling using our back, okay? So I'm gonna have Nicole come in so she can demonstrate. So I'm gonna have Nicole actually face the window first for me, Nicole. And basically, let's demonstrate that hinge. So you'll see Nicole kind of tap her hips and push them back, almost like she's trying to fold on her pinkies, right? So she's folding her hips down on her pinkies. And that's the hinge that we're looking for, creating the movement of moving the weight back into the sole of the foot, or into the heel of the foot rather. So now let's have Nicole straddle that kettlebell. The key here is I want to keep that kettlebell as close to Nicole's body as possible. The farther it is in front of her, the heavier it becomes. So keep it as close to your body as possible. I want Nicole to stand up nice and tall. I want her to keep her head and chest in that straight line. I'm going to have her hinge at the hips. Then she's going to bend her knees to lower her hands down to the kettlebell. I'm going to have her raise her butt just a little bit to create some tension in her hamstrings. She's going to press the floor away or press through her heels as she stands up. You heard her breath there, so the key there is creating that exhalation to create the core tension. Now, the key to this is I want to make sure that Nicole puts it down in the exact same way that she picked it up. So her head and chest is up. She's going to hinge back at her hips. She's going to bend her knees to lower that kettlebell to the floor. I want you to notice from the side that that kettlebell ended up in just the same position that Nicole picked it up from, okay? If it goes out in front, it's making it heavier, okay? It's just as easy to get hurt picking something up as it is putting something down. So make sure whenever you lift anything, whether it's this kettlebell or that grocery bag or whatever it is, you always have a plan for how you're gonna lift it and how you're gonna put it down, okay? So let's have Nicole do that again. I'm gonna have you face the camera this time if you don't mind, Nicole. I want you to pay attention here to where Nicole's feet are. They're gonna be hip width apart. That kettlebell is gonna be centered in between those feet with the handle about where she would tie her shoelaces, okay? And actually, depending on who you listen to, you can even go back a little bit farther. But you don't want to go any farther forward than where you would tie your shoelaces, okay? So again, she's going to hinge those hips back. Notice that her eyes go to the floor here. She's not staring off in the horizon. She's going to lower herself to the handle of that kettlebell. We're going to hear her exhale as she lifts and presses that floor away. Good. Let's have you lower it back down to the floor. Again, same process. The sequence of events is exactly the same whether she's picking it up or putting it down. All right? I think that's pretty much it. If you guys have any questions on this exercise, please let us know. More than happy to answer whatever questions you have. And thanks for paying attention to these videos. We appreciate the feedback we've been getting. If you have any questions, email us at info@freedom-chiro.com and Nicole will make sure to respond to it. All right? Thank you very much and have a great day.